Support for Arkansas Week provided by the Arkansas Democrat-Gazette, the Arkansas Times, and Little Rock Public Radio.
And hello again, everyone, and thanks very much for being with us. Its origins date to World War I, or its end. And a century and some years later, the nation, come Monday, will observe Veterans Day yet again. It's a time to not only thank those women and men who wore the uniform, but to assess the issues surrounding military veterans and how and to what extent those issues are being addressed. Well, in a moment, we'll speak with three individuals for whom veterans' issues are their work. First, the election just concluded, an election that set the nation and indeed the world on its ear. There were rather fewer surprises on the state and local level, but the balloting in Arkansas still demands some analysis. So to do that, a pair of old friends. We're joined by Hal Bass, emeritus professor of political science at Ouachita Baptist University, and Skip Rutherford, the dean emeritus of the Clinton School of Public Service and a founder of the Central Arkansas Political Animals Club. Gents, thanks for coming in. Hal, we'll start with you. It's over, the counted. I mean, we may not know who controls at this particular moment the U.S. House of Representatives. Pretty much everything else around here has been settled. What's your takeaway?
It was a wave election. More a ripple than a big wave, but a real consistent pattern of improving support for a Republican presidential candidate across the country.
Yeah.
In state after state, county after county, you saw perceptible increases in the Republican support in what looked to be a very, very close election, tipped into a close but decisive election outcome.
Yeah. Skip, we went right, the country and the state.
That's right. And you got to give the Trump organization credit. I mean, let's just give credit where it is due in the fact that he captured the mood of the people, which was an economic anxiety. His grievances became people's grievances. And he ran a very good structured campaign, particularly in turning out working class and younger male voters. He did a good job on that. But I would also say I didn't agree with Hal. When you look at wave and landslide elections, I think back to 1972 when Richard Nixon beat George McGovern and McGovern carried one state in the District of Columbia. And then you go to 84 when Reagan beat Walter Mondale, and Mondale carried his home state in the District of Columbia. This was a significant election in 2024, but it wasn't a rout.
He won women and did well in the suburbs, despite all of the rhetoric on his part and that of his associates. He did surprise.
That reflects Skip's point about Trump captured the mood of the country, and the Democratic campaign just missed the boat.
Yeah, and I think if you read the great book that Angie Maxwell wrote about Southern politics and particularly Southern women,
of Fayetteville,
yeah, at the University of Arkansas, a lot of women relate to the policies of President Trump beyond just the abortion issue, economic issue, the grievance. We are rural, we are forgotten, we are poor. And people went in and, quite frankly, the cost of a carton of eggs, offset, I'm worried about our democracy.
Yeah. Ukraine, and it was way down.
And I do think the gender gap, and it's been around since 1980, is most clear on the female Democratic side for college-educated women. And I think there are a lot of women who are not college-educated and simply do not relate to politics and culture the same way that the Democrats' campaign anticipated they would.
Yeah, and you're exactly right. I agree with that. The other thing about this election that a lot of people are not talking about is that, they're still counting votes, Steve. So
yeah.
It's going to take a couple of weeks for all these votes to come in. But President Trump is probably going to get at, near, or barely exceed the level that he got in 2020, somewhere in the 74, 75 million range. Vice President Harris is probably going to get 70, 71, 72, somewhere in that range, and maybe lower than that. President Biden got 81 million votes 4 years ago, 81 million votes. Now, President Trump picked up a lot of Biden voters, and I think Kamala Harris picked up a significant number of Republican women, particularly on the abortion issue in certain states. But the real story of this election is probably, in the end, 10 million people who supported Biden didn't vote. Didn't go out. They may not have switched to Trump. Some did, but they didn't vote.
Alienation.
The voter turnout in this election dropped way back. And so when you're counting, I mean, Joe Biden got 81 million votes, the most votes in any presidential campaign by any one person. The highest number of presidential votes ever. This year, as popular and as strong as Donald Trump was, he's not going to reach that number. So a lot of people, unfortunately, who could have voted, didn't vote.
Well, we don't know about the House yet, but certainly the senior senator from Arkansas is going to get a chief. He's a ranking member already on Ag, but once again, Arkansas will have a chairman of the Ag Committee. There could be some other shifts.
Yes, John Bozeman is the ranking member, and he will presumably assume the chairmanship of Agriculture, Nutrition, and Forestry. Blanche Lincoln's old chair come January, and he's got work to do because the Farm Bill is overdue.
Yeah, one thing I think about Senator Bozeman is, and about the Farm Bill, it's one of those pieces of legislation, having worked for Senator David Pryor when he was on the Senate Agriculture Committee. It's one of those pieces of legislation that is not DNR as much as it is crop and other things. I mean, so the Midwest farmers, the fruit growers in the South, the cotton farmers, the chicken producers, it's a complicated mix to bring regional people together, less partisan. John Bozeman, I think, will do a good job getting that done.
Fair to say that Sarah Huckabee Sanders she's emboldened. I mean, she's stronger than she was yesterday, and yesterday she was stronger than.
Yeah, no question. She solidified her power, and she's got 2 new Supreme Court seats to fill.
Plus, she'll have a Secretary of State appointment. Yeah, and come January, another appointment. Skip.
Yeah, I agree. I think number one, and she's probably also in the position, Hal being the Ouachita guy, that she's probably in the position that if she wanted a position in the Trump administration, she could have it. I think it's questionable whether she wants it, but I think she could certainly. But I think the real issue is that, she's got, she earned a lot of points on the road by supporting candidates, and long term, whether that is now or in the future, that will help her.
Yeah, she's known in the community, the political community, so to speak. Well, we ought to mention that the ballot issue that had a lot of attention, particularly in the last week, was the casino thing in next door Pope County. And I ran into so many people who said, I don't have a dog in that hunt, I don't understand it, but as it turns out, the thing passed. Skip?
Well, look, I think the real question is that most people really didn't understand it. The key thing that obviously, in my opinion, because I didn't have any idea how it was going to come out. I had no really strong sense. Because most of the people that came to me talking about it said, well, what is that amendment? What does that do? I think the local control issue was probably the factor of paying, local folks should have a say in whether there's a casino in their particular county. I think that may have been the factor. But Steve, the margin surprised me.
Hal?
I think more generally that in these ballot measures, which do not have party labels attached to them, they're simply going to be, by definition, more unpredictable in their outcomes. Party is such a defining force in voting behavior. When you take it away, you do keep folks like me who try to figure out why these things happen.
Yeah.
You take the easy and obvious answer away from us here and make it a much tougher call to make.
Yeah. Look to the General Assembly. Democrats pick up 1 seat, but it is still a Republican capital, state capital.
Yeah, and it is. I think that what you really have in Arkansas is Trump's got, he increased his vote. Right. It became, Arkansas's red became even more red, as it has in every Trump election. But you still have that strong Democratic base in Pulaski and Jefferson counties, which keeps the party viable. And you are picking up something. I think the Diana Gonzalez's win in Northwest Arkansas, while only one, may be an indication of Northwest Arkansas is moving more, or at least portions of Northwest Arkansas, moving more to purple.
Yeah.
The margins were lower in Washington County than statewide in the other red counties around the state.
Yeah, I want to mention too, because we covered it last week, and it is Arkansas's capital city, the sales tax vote failed again. Skip, this is twice on the mayor's watch.
Yeah, and again, you were dealing in an environment where economic uncertainty toppled Kamala Harris. 45% of the people who voted in exit polls, leaving the national election, Steve, said, I'm worse off economically now than I was 4 years ago. So I think the economic considerations had a big thing to do with it. I think the second thing that had something to do with it was it looked like I don't think they ran a very good campaign pro. I think the con ran a much better campaign. But it looked like you had a Christmas tree and every city director put an ornament on there and said, this is what I want for my zone. The key thing about that is North Little Rock voted against a school millage. So that people were not in a tax-friendly mood in this election. Does it impact Mayor Scott? I don't think so. Because when you look at the city board election, Antoine Phillips got 59% of the vote in that race. And Frank Scott's popularity is not necessarily linked with a tax increase or decrease.
Yeah. Hal, I'll give you the final word.
Sales tax are a tough sell.
And we got into it there because we're simply out of time. Guys, thanks for coming in.
Golly,
Be back
that was
soon.
quick.
Yeah.
That was quick.
Well, of course it was.
But
Smart
fun.
guys.
Lots of fun.
We'll be back in a moment. We are back. Veterans Day 2024. Some hours of entirely appropriate ceremony and remembrance. And let us set the stage for that now. We are joined by Secretary Kendall Penn of the Arkansas Department of Veterans Affairs, and from the Central Arkansas Veterans Healthcare System, Dr. Jennifer Anderson, Chief of Staff, and Dr. Matthew Goodwin. Welcome to all of you. Mr. Secretary, we'll start with you. Well, first of all, let's jump forward to Monday. You've got a big ceremony planned.
Yes, sir. Monday at 11 o'clock, so the 11th hour of the 11th day of the 11th month, in keeping with the tradition of Armistice Day, we are holding the state Veterans Day ceremony at the North Little Rock Veterans Home over by Fort Roots. Our keynote speaker is going to be General Bridges, the new Adjutant General for the Arkansas National Guard. We've got an opportunity to bring in both the veterans that we have living there at the home, as well as the veterans over at Fort Roots to be a part of our ceremony. Really looking forward to it, and we hope to have a large turnout from the public.
We kind of owe a debt maybe to the French, or at least the Treaty of Versailles anyway, or the little city of Versailles.
Yes, sir. So, you know, there for a long time it was called Armistice Day, and then after the conclusion of World War II and the Korean War, the Congress started looking for ways to honor the service of all veterans, and so the name of the holiday was changed to Veterans Day.
Yeah, 11/11/11.
Yes, sir.
All right, on to the business of healthcare. And we have multiple, well, at least two major agencies, right, serving the vets in Arkansas.
Yes, sir. So my colleagues here are with the U.S. Department of Veterans Affairs, right. The federal agency. I'm from the Arkansas Department of Veterans Affairs, the state agency and responsible for veteran issues and policy. Key difference is, I guess, when you think of normally Veterans Affairs or veterans kind of issues, you're normally thinking about the services provided by the U.S. Department of Veterans Affairs, whether
VA.
Whether it's health care, education benefits, housing benefits, et cetera. The Arkansas Department of Veterans Affairs, by comparison, we have three main lines of effort or focus areas, if you will. We run two long-term care facilities, one here in North Little Rock and one up in Northwest Arkansas for veterans. We run two cemeteries for veterans, again, one in North Little Rock and then one up in the small Northeast Arkansas community of Bird Eye. And then we provide services for veterans and their spouses who are looking to sign up for disability benefits throughout the state in concert with the county judges. And so those are the key breakdowns for our agency.
But in terms of issues facing a veteran, not only in Arkansas but everywhere, healthcare would seem to be near the top of the list, Doctor.
Absolutely, near the top of the list. And that's what the Veterans Health Administration, our branch of the Department of Veteran Affairs, is here for. Our mission is to provide exceptional health care to our veterans, to promote health and well-being. And that's what we do here in Central Arkansas, and we're very proud of what we have to offer.
Well, and that's been expanded, actually, through legislation.
Correct.
Right.
So PACT Act legislation that went into effect in 2022 expanded healthcare eligibility to veterans based on location of service, length of service, and some exposures during service. And I think we have worked very closely with ADVA to promote PACT Act information, education, and eligibility information to veterans. Part of that PACT Act said that the VA must screen all our eligible enrolled veterans for toxic exposures every 5 years.
It's chemical exposure.
Absolutely.
Okay.
Or that location of service and time of service. Okay. We're very proud. The VA, since PACT Act implementation, has, in Central Arkansas, we have screened more than 48,000 veterans for toxic exposures and then worked on follow-up care for those veterans as well. The VA nationwide has screened over 5.8 million.
Do we have a sense in Arkansas how many we have not screened?
I don't have that number for the whole state. I can get that for you. I think we have many opportunities to screen veterans. We can do that through any appointment at the VA. They can also do it via phone. So I have two phone numbers. You can call 501-257-6020 or 501-257-4031, and we can screen you over the phone.
Yeah, and we'll try to add those numbers too as we
Absolutely.
go. Pain care is a new, not necessarily a new facet, but would it be fair to say there's an added emphasis on that, a new emphasis?
Absolutely. We know that many veterans are struggling with pain from wartime injuries and also just the normal aging process, and we want to be state-of-the-art at our VA healthcare system. So we've been very fortunate to build interdisciplinary pain teams. We have pain-boarded physicians. We have pain specialists, pharmacists, psychologists, and social workers providing anything from medication management, safe narcotic prescribing, and hopefully safe alternatives to that. Our doctors also perform procedures, spine procedures, injections, spinal cord stimulators when appropriate, and also using ketamine infusions, which is a little bit newer approach to pain management.
Right. This is delicate territory, pain management, whether it's government or civilian medicine. the implications of any kind of pain medication practice are pretty stringent. You know?
Yes. We work diligently to work with our state partners, check our safe prescription drug monitoring programs, and really to listen to our veterans and address all aspects of pain. So we've employed mental health providers who specialize in pain to work directly with our pain teams. So we're looking at the whole person and really listening and providing. Everyone's different. You know, what works for one person doesn't work for the other. And so we have a whole host of options to safely treat pain and address all aspects of it.
Telehealth may not be new to the VA or to Veterans Health Care, but it's expanding as well, right?
Right.
Janice?
We really brought on by the pandemic, we were already using some telehealth modalities. The pandemic really forced that and made us really look at ways that we could provide alternative care out at where and meet the veteran where they are in the community. One recent expansion in telehealth that the Central Arkansas VA has made is to add tele-emergency care services. So oftentimes if we have a injury or illness that is not major but does need quick attention, through telehealth we can offer access to an emergency care physician Monday through Friday, 8 to 3:30. You can call our contact center, get immediately put in with the emergency care physician. These are board certified emergency care doctors, and they can address your needs remotely in the comfort of your own home and save you a trip to that emergency department. And you can access that by calling our main number, 501-257-1000, and hit option 3. Or we also have a toll-free number, 1-800-224-8387.
Is there an outreach program to let vets know that these services are now available or newly or expanding?
Absolutely. We have sent this message out through our town halls, through our veteran service organizations, ADVA, other folks in the community that we work with. We want to get the message out as wide as possible, and also through our local clinics.
Is there, in your encounters or in your dealings with, certainly on a clinical basis with veterans, are there top 1, 2, or 3 clinical issues that vets seem to be facing?
I think, as Dr. Goodwin mentioned, pain management is a big issue. Whole health, general wellness. How can we make ourselves in better shape to last longer, right? And be well, and the quality of our health care, I think, is very important to veterans. And then access, getting the care they need when they need it.
And I would add on to that.
Please.
Where they need it. And I'm a native Arkansan, I'm a 4th generation native Arkansan, many from rural Arkansas. And we know that all veterans don't live right around our hospital in Little Rock. So I'm extremely proud of our team for pushing our care out into the state physically. We have now physical therapy clinics in all of our 8 community-based clinics, from El Dorado to Mountain Home and Mena to Searcy. We've got the state covered with direct access to care. Speaking of pain, we partnered and received national funding to build a tele-pain program that's fully staffed, physicians, psychologists, social workers, pharmacists, to perform comprehensive pain management services in the home or in those clinics directly to veterans. 2 other services to mention quickly that we're very proud of, and many people don't know, we operate a home-based primary care group for veterans where we provide full primary care services in the home for some of our highest needs, most complex veterans. Again, physicians, physical therapists, occupational therapists, psychologists, looking after not only the veteran but also the caregiver. And I'm proud to say that service has almost doubled since the pandemic, now serving over 400 veterans in their home, meeting their needs there. And lastly, we know that we have a lot of aging veterans, a lot of aging population. Now, we want to make sure we're meeting the unique healthcare needs of that population. So we have worked very hard to earn and spread what we call age-friendly designation. And so that is equipping not only geriatric providers, but our primary care providers with the knowledge that it takes to elicit the special needs of this aging population. So we're proud that that's out in our community, in our emergency room, our surgical services. So I'm very proud to reach out to rural Arkansans.
A few seconds remaining. Let me give it to Secretary Penn if I can. How close? And you're aware of this. I mean, in every administration, it seems like there is always fresh criticism of the care that's being afforded American veterans. How close, in your estimation, are we to getting the job done?
Well, I can only speak from my own
Sure.
viewpoint. So I utilize the VA healthcare system, and I only started here just about 6 months ago, and I was blown away by the level of care and the comprehensive service that you get when you go in there. I mean, normally under managed care out in the civilian community, everything is weighed against how much it's going to cost. In the VA, it's weighed against what does the veteran need. And I can't say just anything more than what a great job you folks do over there.
Got to end it there because we're simply out of time. To all three of you, our thanks for coming in. And of course, to our veterans, thank you especially. Thanks for joining us. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and Little Rock Public Radio.